Here are 5 top tips for eating well with type 1 diabetes. Before looking at the top tips, the targets for children diagnosed with type 1 diabetes, according to NICE, is to aim for a HbA1c lower than 48 millimoles per mole or lower than 6.5%. Ideally, if we can get as close to this target as possible, taking into account individual daily activities and risk of hypoglycemia. To achieve this, we need to consider maximising time our blood glucose levels are within the target range, balancing our diet, insulin and activity to minimise variability, and to remember we need to maintain a good quality of life. Thinking about a healthy balanced diet, the Eat Well guide shows the proportions in which different groups of foods are needed in order to have a well-balanced and healthy diet. The proportions shown are representative of each food eaten over the course of a day or more, not necessarily at each mealtime. Choose a variety of different foods from each food group to help get the wide range of nutrients the body needs to stay healthy. Tip number 1, base your meals around starchy carbohydrates. Tip number 2, choose whole grain, seeded, whole wheat varieties of bread, rice, pasta and cereal. Whole grain food contains more fibre than white or refined starchy carbohydrates and often contain more nutrients. We also digest whole grain food more slowly, so it can help us feel fuller for longer. Remember, you can always purchase higher fibre white versions of bread and pasta, such as 50-50. This could also be helpful to increase your fibre intake. Tip number 3, choose healthy snacks. Healthy snacks include fruit, vegetables, plain yoghurt, plain popcorn, whole grain crackers, or nuts and seeds such as almonds. Try to avoid frequent grazing throughout the day. Tip number 4, eat 5 portions of fruits and vegetables every day. These could be fresh, frozen, canned, dried, or juiced. A portion of fruit or vegetables is around about 80 grams. For example, 1 apple, 1 medium banana, medium-sized orange, or similar-sized fruit. 3 heaped tablespoons of vegetables, a dessert bowl of salad, and a 150ml glass of fruit juice or smoothie. Ideally, we would suggest if you are choosing fruit that is juiced, to make sure that you only have 1 glass a day. Ideally, choose 2 fruit or 3 vegetables, as fruit contains a natural sugar called fructose. If we eat larger portions of fruit, including fruit juice, this is likely to impact on blood glucose levels. Tip number 5, keep hydrated with water and other sugar-free drinks. Aim to drink 6 to 8 glasses of fluid every day. Water, lower fat milk and sugar-free drinks including tea and coffee all count. Swap sugary soft drinks for diet, sugar-free or no added sugar varieties to reduce your sugar intake in a simple step. Why not consider the try, swap or change planner? Think about the top tips that we've discussed today and think about maybe 1 or 2 tips that you might want to try at home. The NHS Change for Life website is a really helpful resource and can give you lots of tips and ideas. For example, lunch and breakfast swaps, scanning the barcode if you want to check the labels, and spotting the symbols on products in the supermarkets to help you identify good choices. If you would like more information on healthy eating with type 1 diabetes, you could ask to be referred to a diabetes dietitian through the Milton Keynes diabetes team.